All right. Good morning. Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. Summertime is almost here. Memorial Day weekend coming up. Boy, think back to Memorial Day weekend last year. We were all trying to figure out where we're at, what to do, how to be safe. And some people were, if you remember, kind of flaunted the guidelines for masking and social distancing restrictions. If you remember the scenes from, I think it was Missouri and the Ozarks and such. And we've come a long way since then. So where are we right now? Well, nationally we're doing pretty well. We're at a case number is about what it is or was last August, which at the time seemed kind of bad for us, but now seems pretty good, I guess, since what we've gone through. So it's between 20 and 30,000 cases per day in the country. There's still a few hot spots here and there, but it used to be instead of signifying the hot spot as an entire state, now it's come down to an entire county or entire community. So as we've been talking about over the last few months, you know, the waves of COVID going through communities is probably largely over. But you'll still have cluster outbreaks, and those will still occur, particularly in unvaccinated people. Here in Forsyth County, we're stuck between 9 and 10 cases per 100,000 people per day, and our percent positive tests is between 4 and 5%. So we're kind of stuck in that between what the CDC would define as minimal to moderate transmission, maybe itched a little bit more close to the moderate transmission for the community. Our hospitals, just this past week, our numbers have come down modestly from what they were for the 2 months prior to that. But we're still having people admitted to the hospital with COVID every day, including to the ICU. Interestingly, I look back at our own health system data, and so far we've had no hospitalizations since February with anyone who's been vaccinated. These have all been unvaccinated people. So that tells you something a little bit about the power of the vaccines. Variants, people ask me how are we doing with variants. Well, the most common COVID clade or strain now circulating in our region is B117, the UK variant. So everyone's saying, well, when are the variants are going to get here? They're here. In fact, most of the COVID, over half of the COVID circulating is actually a variant right now. And which is a little bit important in one area, we'll talk about it in a minute. It still looks like the vaccines cover the variants pretty well, including some more recent data, early data on the India variant, which is B617, I think. And it looks like it'll cover that too. So that's good news. We still, I think there'll be a booster needed for the COVID vaccine. Probably sometime just after Christmas or around that time frame next year, and that's mostly to shore up immunity against the variants. Some reports this week that immunity to COVID is probably longer than what we were originally thinking it might be, both from natural infection as well as vaccination. So that's good. But as time goes on and the vaccine slides a little bit more towards variants, we'll probably have to shore up immunity. Here in Forsyth County, our vaccinations numbers have fallen off considerably, with the exception of the 12 to 15-year-old group, which there was. We've had some vaccine events for that group in the last few weeks. Both with Wake Forest Baptist Health as well as with Novant and as well as with the county, and those have been largely successful. Some school vaccination programs going on for the 12 to 15-year-olds, and some schools are taking advantage of that. And that's good. And one of the questions we're going to talk about now is that's the ticket for a normal school year, is getting our kids vaccinated. One thing that's come out the last week, Moderna is now submitting its 12 to 17-year-old data for its vaccine, the other messenger RNA vaccine. That's going to the FDA this week. So probably in a month or so, maybe 6 weeks, we'll have another option for the 12 to 17-year-old group. So it'll be the Pfizer and Moderna vaccine. Johnson & Johnson is still working on getting its clinical trial for kids up and running. And then another vaccine, which you're going to be hearing about a little bit, a nanoparticle vaccine, which should be FDA emergency use coming out in the midsummer, is also looking at kids. So we're moving to try to get all our kids vaccinated as well. One thing about vaccination in kids is that they're basically the same as getting it in adults, and so you're going to see a lot of questions here in a minute from people who watch about possible side effects in kids and what they are. Basically, they're the same as adults, and so we'll talk about that in a minute. One thing that I wanted to follow up on, because last week we talked fairly extensively about the CDC's release of its mask guidance, and I wanted to follow up on that a little bit because I think largely most communities in the country have just totally stopped wearing masks, both indoors and outdoors. There are some exceptions. I mean, I've been to places where people are still wearing masks. Employees oftentimes are still wearing them, and I think it's a good idea to respect employees, and you can wear a mask too, because they don't know if you've been vaccinated or not, and that's the primary problem here, is that the CDC said if you're fully vaccinated, you don't have to wear a mask, but there's obviously a lot of unvaccinated people not wearing masks too. So I wanted to talk a little bit about about something we talk about in hospital epidemiology and those of us who follow COVID, is the Swiss cheese model for protection for an individual. And if you know, I don't have a picture of Swiss cheese, but most of you know what it is. It's a piece of cheese and it's got holes in it. And if you line up several pieces of Swiss cheese and you try to move something through the holes, eventually it'll get stuck somewhere going through the Swiss cheese, so it can't find a hole to get through. And so looking at an individual, that's kind of like the way this works. Another example of that are those little kids' toys where you watch the ball fall down on each individual level, try to find a hole to get down to the next level, and a bit of a game. So it's sort of the same way with COVID. What you want is for the virus that's going through the little holes in the cheese to not make it to the other side, because that would signify an infection. So the more layers you have of Swiss cheese in between, the more likely you're not going to get through. So the strongest piece of Swiss cheese we have is vaccine, and to prevent you from getting infected. The second strongest is masking, both for the individual but also from the other person who could potentially be spreading it to you. And then the third one is social distancing, and then there's the hand hygiene and other things. But vaccine and masking are your two biggest. So if you're not vaccinated, what is going to be your strongest piece of Swiss cheese is your mask, and the people around you masking. And that includes people who can't get vaccinated yet, like our children, and it also immunocompromised people who don't respond to the vaccine as much. They don't have that piece of Swiss cheese. That's the strongest one. So they rely on the masks. So when the unvaccinated population abandons their masks, now you're missing two pieces of Swiss cheese. And you're probably also not social distancing, which means that you're going to get COVID when it comes through your group of people and with your community. And so there was an interesting analysis that was done this last week that I saw, which took our whole, while all our communities, the rates of COVID are coming down. But if you factor out everyone who's been vaccinated, leaving only the unvaccinated people in the graph. So you take the vaccinated people out, you only have unvaccinated people left on the graph. The rate's actually going up, and it's going up slowly. And so if you look at the transmission factors, it's what we call R0 in the epidemiology world. For vaccinated people, R0's way less than 1, which means infections aren't spreading in that group. But in the unvaccinated, it has actually gone up, and it's over 3 now, which means that because of variants, COVID is now being transmitted in unvaccinated people at a faster rate than it was for the community at large back in January, which was our hardest time. So if you're unvaccinated, your risk has actually gone up in the last few weeks because the mask has come off. And so it's just something to think about. So obviously it's a good reason to get a vaccine. And it's also, if you're not vaccinated, if you've not had COVID before, you don't want to wear your mask, particularly indoors, or we're doing things like going to the fitness center, going to places where there's a lot of other people. So just a word of advice for the unvaccinated group of people. And we'll talk in a minute here when we get to our questions. What about the kids and such who can't get vaccinated? How do we modify our behavior some for them? So I think we'll go ahead and go to the questions now that we solicited from people. And the first one's a little bit of a tough one. It's from Peggy, and she says, I know someone who does not want to be vaccinated because she says so many people are dying from the vaccine. Can you give us the daily deaths connected with the vaccine? Well, the short answer is daily deaths. No, the number is 0 for daily deaths. This, by the way, is one of the big things that's circulating in social media that started out in the anti-vaccine groups. These are the people who not only don't want you to get COVID vaccine, they don't want you to get whooping cough vaccine or measles vaccine or any vaccine at all, which obviously from a public health standpoint would put us back in the 1920s as far as communicable diseases transmission. So you got to be a little bit wary that the anti-vaccine people are pretty active in putting stuff out like this. So you can't measure daily deaths due to the vaccine. So let's just take a few of the potential more serious adverse events from the vaccines. So the messenger RNA vaccines, there's 1 in a million chances of anaphylaxis. Anaphylaxis being an allergic reaction, kind of like what some people get from a bee sting. 1 in a million. And how many deaths have we had from anaphylaxis due to the vaccines? 0. Because we monitor for that and we watch for that afterwards, and it's really easily treated. Johnson & Johnson's vaccine has a risk of blood clots, particularly in younger people, and then younger being defined under 50, which is a generous younger, and then women. What's that risk? It's about 5 to 7 per million people, so that's uncommon. And in that group, unfortunately, there have been some deaths, but it's less than 10 so far that we've had from the Johnson & Johnson vaccine. So how am I going to tell you a daily death rate from the vaccine is when it's that uncommon that it's happening in less than 1 in a million times. So the vaccines are safe. Teresa says it's been said that vaccines in 12 to 14-year-olds may cause heart problems. Is this true? No, not really. It's not true. So what you may be hearing about is right now the CDC is looking at myocarditis, which is an inflammation of the heart that has been reported through VAERS, and VAERS is our vaccine adverse event reporting system we use for all vaccines, actually, not just COVID. That myocarditis is that has been reported seems to be in people more under the age of 35. So it's not just 12 to 14-year-olds. And actually, the early information that we're getting, now we're putting all the cases together and really looking at them, it very likely is not related to the vaccine. So here's what happens. Myocarditis it happens in young people even without the vaccine. Right now, the most common cause of myocarditis is COVID. It's the infection, and it causes myocarditis. That's what, remember, where we were worried about all the athletes and the MRI showing inflammation in the heart after they've had COVID? That's myocarditis. The most common cause of myocarditis outside of the time of COVID is actually enteroviruses. And enteroviruses are a group of viruses that tend to circulate particularly in the early fall and again in the spring. The list of viruses that can cause myocarditis is about that long. And flu being on the list, RSV on the list, paraflu, adeno, could give you a whole, I won't go through the whole list, I'll spare you. But it's all viruses that transmit between people. There's an interesting thing happening right now in North America is that our cases of RSV, which is respiratory syncytial virus, is spiked to much greater than what we usually see at this time of year. And it's likely a rebound from not masking anymore because normally that virus is a wintertime, late winter, early spring. And we're seeing it now. Last summer here in the winter in Australia, they saw the same rebound in Australia afterwards. So it's kind of like some of these respiratory viruses and enteroviruses, they've not been circulating in the last few months because we've all been wearing masks and it keeps us from getting those too. We had no flu season, for instance. But now that the masks are coming off, we're having rebounds and infections due to these other common viruses. Some of these common viruses cause endocarditis or myocarditis. And so I think what we're seeing actually right now is the usual spring myocarditis, but we're more aware of it because young people are getting vaccinated roughly at the same time that that's circulating. So the number that we're seeing right now is at the same background that we would normally see even when COVID's not around or the COVID vaccine's not around. So a couple of the cases of myocarditis that I've known about actually probably turned out to be due to the virus of COVID itself and not due to the vaccine. It was just a little bit of timing that occurred. So I really wouldn't use that as a reason to not get your child vaccinated. In fact, the risk of your child getting COVID and getting myocarditis that way is much higher than any putative or possible association with the vaccine. If a 16-year-old has 3 or more adverse reactions to the flu vaccine, should they be concerned about the Pfizer COVID vaccine? She is not supposed to get the flu vaccine because of her past reactions. It depends a little bit about what that reaction is. If it's a reaction actually of an anaphylaxis allergic response to the flu vaccine, then you should not get the COVID vaccine. But other than that, they can go ahead and get it. There's no reason not to. Lauren asked, what do you say to the idea that since kids generally get mild cases, we shouldn't worry about them contracting COVID, that once parents and grandparents are vaccinated, can we resume life as normal? If your child's not vaccinated, you You can get more close to normal if your parents and grandparents are vaccinated, but you're not going to quite get all the way there. So let me explain. If your children are unvaccinated, but the grandparents but the grandparents still have underlying medical problems or at the older end of age, then the children that are unvaccinated could potentially have COVID asymptomatically during a visit with them, and could potentially still expose the vaccinated grandparents. Most of the time that's going to be okay, and the outcome of that will be fine, but every now and then you're going to get a breakthrough COVID infection in the older people. If your kids aren't vaccinated and you're going to visit grandparents who have comorbidities, other diseases, other underlying medical problems, or immunocompromised, or frail, or at the extremes of age, your child should mask during that visit, and the grandparents might want to mask too. Give you another layer of Swiss cheese in there to keep the virus from getting through. Another situation is if your child is unvaccinated and your child is exposed to COVID, you're going to be spending 10 to 14 days in quarantine just because of that exposure. And let me tell you, that's not fun. And so, talk about affecting your family's lifestyle. That's the ultimate not normal, is being in quarantine. If your child's been vaccinated, then you don't have to quarantine. So I'm going to just reiterate what we talked about last week, the reasons for a 12 to and over adolescent to get vaccinated. One, to protect themselves from COVID. Kids do get COVID. Occasionally they'll get sick from COVID. It's unusual. So far there's been over 1,000 cases of multi-system inflammatory disorder in kids in the United States. It's a low number. It's across the whole U.S., it's across the whole COVID pandemic. It's a low number, but if you're that one, it's not good. And so, who would want that to happen? Get vaccinated, it's not going to happen. So protect your child. Two is to protect the people around your child, so everyone in the cocoon and in the household, if the child's not going to get infected, then you don't have to worry about someone else in the household, even if vaccinated, getting infected from them. Third reason is to protect the community at large. So the more people in a community that are vaccinated, the harder it is for the virus to transmit. The fourth reason is that you can be a lot more confident that your normal activities or activities that you want to do can be done safely. You want to travel, you want to get in an airplane, you want to go to a concert, you want to go to a ballet recital, you want your child to be in athletics, you want summer camp experience, you want a day camp experience, you want athletics. All those things can be done with a lot more peace of mind if your adolescent's been vaccinated. And lastly, if your child happens to be exposed in some situation, you don't have to quarantine, which means during school time, you don't have to do virtual learning. And that is a big deal. You can keep the child in school. So those are the reasons to get your child vaccinated. Christine asks, some health systems are requiring staff to get the vaccine. Why aren't all health facilities requiring this? Well, that's a good question. And I will tell you, all healthcare facilities are talking about it. Some have done it already, the reason for a healthcare system to require and mandate vaccine is to protect patients, and that's the main reason. The second good reason is to protect the staff, because obviously healthcare workers are going to be more likely to be exposed because of their occupation and what they do. If for some reason a patient's admitted and we don't know they have COVID, an exposure could occur. So there's been a lot of discussion about doing so. Why has not all of the healthcare systems done it yet? One is it takes a while to do such a mandate. A lot of places want to see how many of their own are going to get vaccinated voluntarily, and maybe you won't need to mandate. If everyone does it and says, I'm here for the good of everybody and the good of the many over the good of the few, I'm going to get vaccinated too, and everybody does that, then you don't have to mandate it. Two is you have to go through the process of looking at how to systematically put that in place, because you have to have a system for mandating vaccine. So a lot of us have had experience with doing it with mandating flu vaccine. It takes a few months to get it implemented. Another reason is that some people are waiting for the vaccines to become FDA approved rather than under an emergency use, because it makes it easier to actually be a provider of a vaccine and a mandator of a vaccine at the same time. And so we anticipate that Pfizer and Moderna both will be FDA approved sometime this summer. So some are waiting for that to happen. Also, healthcare systems like to do things roughly at the same time. No one likes to be the nail that sticks out. There's a lot of discussion between different health systems right now about when mandating is done, is that a good majority of them will do it at the same time. To that end, the Infectious Diseases Society of America and the Society of Hospital Epidemiologists of America right now have a task force that's looking at how, when, why, and all of the what-fors involving healthcare system mandating COVID vaccine. And that task force probably won't report out for another 4 to 6 weeks. And so people are kind of looking to see what they might have to say. So those are the reasons. I'll go on the, I'll go out there right now. Personally, I think a healthcare system should mandate vaccine for their staff, particularly for those people who are involved in patient care, and to protect their patients and to protect themselves. And when that happens, then maybe healthcare systems won't need to be doing universal masking in all places at all times. And that would be something that would be make it easier for our healthcare workers. So I'll go on out there and on the limb and say, yeah, I think we should be mandating, but I think we need to do it when the time is right, and I think we need to think about it and do it the right way and bring everyone up and lift all boats with it at the same time and not rush it. So Kathy asks a related question. What threshold do you think needs to be met for healthcare facilities to lift the mask mandate? Kathy, I'll let you know that some people, some of us are talking about, maybe the mask mandate will never go away in healthcare because all of the respiratory viruses out there are prevented by masks, or largely prevented anyway. And it may be something for patient safety anyway. So, an immunocompromised person getting a routine cold virus can be serious, actually. So if you have an opportunity to prevent that from happening. So that discussion is going on, but I would say that, one, you would have to have minimal and sustained transmission of COVID in the community. Most communities aren't there yet quite. And two is that you need to have a vast majority of your healthcare workers vaccinated. And not a lot of health systems are there yet either. So when will it happen? I can't tell you exactly. Potentially never, but more likely when those two factors have happened. So if you don't want to wear your mask as a healthcare worker and you haven't got your vaccine yet, you know what you can do. Go get vaccinated. what will these boosters look like? If we got Moderna first, could we end up getting a Pfizer booster? More likely, no. When the boosters come out to boost us up against the variants, you'll likely be getting the same vaccine that you got initially. And the reason why is because that's what the studies are being done, and so we will know the science a little better. Having said that, if that vaccine is not available to you, yes, you could potentially get one of the others, and it would be okay. In fact, right now, that's even okay. If you get your first shot with Pfizer and then you go to your vaccine center 21 days later and they say, well, we only have Moderna and we're only going to have Moderna for a while, you could get the Moderna vaccine as your second shot. So, in fact, ACIP and CDC says it's okay if the other one's not available. In reality, most of the time it is available, so it doesn't come up that much. If you got J&J shot this spring, can you also get Pfizer and Moderna now as extra protection? And Pam asked that, and I'm going to tell Pam that is a very good question because I'm getting that a lot now, particularly for people who are immunocompromised. And it gives me a chance to talk about some stuff that's sort of more science and doctory stuff. And I'll try to talk you through it. So if you got vaccinated for COVID, how do you know your immune system responded? Hey, maybe you got a fever, you got a little achy afterwards for half a day. That's a pretty good indication you did respond because that's your immune system doing that. But how do you know for sure? So what people want to do is go out and get an antibody test. Don't do that. Do not look to see a vaccine response by getting an antibody test. And let me tell you why. One is the antibody tests that most doctors have available to them are specifically designed to diagnose past history of having the natural infection of COVID. They measure a potpourri and cross-section of antibodies associated with natural infection. They don't measure the potpourri or cross-section of antibodies that are related to vaccination. Two is a lot of the screening antibody tests that are done are not all that sensitive. So if you're involved in a study, for instance, looking at the prevalence of antibodies in a population, and that test comes back negative and you've been vaccinated, do not freak out because that test is not designed to look for a vaccine response at all. Thirdly is we don't know yet what the correlate of immunity is for antibodies after COVID vaccination. We haven't determined it yet. So we know it for whooping cough, we know it for measles, we know it for mumps, we know it for all these other diseases because we've been studying them a long time. But we don't know that yet for COVID. You have to do large population-based studies that take a long time to figure that out, and you have to use the right antibody test for that. So you have to specifically look for a vaccine response antibody test. Also, we don't know, is it all about antibodies? And just this week, there was a study saying, these are all these other bone marrow cells that seem to recognize and know when COVID is around, and those are responsible for immunity too. Then we have what are called T cells that help us fight infections, and they may recognize COVID, and they're not measured by antibody tests. We have natural killer cells, we have innate immunity. There's a lot of other factors in our immune systems that battle viruses that aren't antibodies. So we need to wait a little bit longer in order to understand what the antibody response really is and then order the correct test. Who will this be important for? It won't be important for healthy people. It'll be important for people who are immunocompromised, organ transplant patients, people who are on immunocompromising drugs, bone marrow transplant patients, dialysis patients, these groups of people. These are the ones we really need to know whether they responded to the vaccine. because otherwise normal healthy people, it's more than a 95% you're going to respond to one of these vaccines. So you don't need to check. So what about saying, well, if one vaccine is good and I got 2 shots, why not get a third? Wouldn't it just boost me? Well, we don't know. And actually, those studies are being done right now on immunocompromised people, because that's the group of people we need to make sure have a good immune response. So I would not get an extra shot, no. And even right now, until the studies are finished in the immunocompromised people, I'm telling our immunocompromised patients not to get a third shot of the messenger RNA vaccines. There is actually a potential that you could actually diminish your immune response by getting too many shots, like we see with the pneumonia shots sometimes. So, I would not recommend that right now. So that's a very good question, one I get asked a lot. Is the vaccine safe for those trying to conceive or breastfeeding? Where's the data to support that? Well, there's a registry for people who are pregnant, who've gotten the vaccine, and both here and as well as in several countries in Europe. And there's a lot of people now in that registry, and the vaccine is safe in pregnancy, both with the registry data as well as what our experience has been since the shots come out. Same thing with breastfeeding, and actually the data shows that if you get the COVID vaccine in your breastfeeding, you'll actually have antibodies against COVID in your breast milk, and your baby will get that, so they'll get a little bit of protection from COVID because of the breastfeeding if you get the vaccine. And as far as conceiving, there would be no biologic plausibility that the vaccine would interfere with your ability to conceive, and we have not seen that in over 170 million doses now of vaccine given. So I would be reassured if you're trying to conceive or breastfeeding that the vaccines are safe. Anne asks, I am immune compromised. How do I determine how effective the vaccine was for me? I received both doses of Moderna. It says listening from Portage, Wisconsin. So, Anne, I'm from Eau Claire originally, so just down the road. So we talked about that. If you're immunocompromised, the studies are going on right now to see how's the best way to measure immune response in that group of people, because your response to the vaccine largely, depending on how you're immunocompromised, will be diminished to some extent. And it very well could at some point be an antibody test, but what we need to know is what the cutoff value is for immunity. And we need to know what's the best test to use, and those studies are being done now. So I would say right now, hang on. If you've gotten your 2 doses of vaccine, hang on. And in the interim, you should elevate your level of protection. So if you're immunocompromised and have been vaccinated, then your layer of Swiss cheese representing vaccination is not going to be as strong as someone who's not immunocompromised. So insert another layer of Swiss cheese. Keep your mask, and if you're going to places where there's a lot of people, particularly people who may be unvaccinated and unmasked around you, double mask and get a good fit. And because double masking helps protect you better than single masking. And the CDC website shows how to do that. Or you can use a well-fitting surgical mask that has a certain thing around the nose and such that keeps it up against the face. So you insert in an extra layer of Swiss cheese. There may be some situations you might want to avoid. For instance, if your place of worship has a large number of unmasked people in it and you're not really sure about their vaccine status, you might want to attend online rather than going in person. You're immune compromised, throw a little extra layer of caution in there. You know, if you're going to be meeting with a bunch of a book club or friends, or have it outdoors, do it at a picnic pavilion, and that's an extra layer of Swiss cheese in there for you, because being outdoors is safer. So that's right now. That's what I would say to do for immunocompromised people. My husband and I are both 75, and we were both very sick with COVID. He was hospitalized for 10 days. Last week we got our first Moderna shot, and both of us had fevers over 100 degrees and chills for 48 hours. Is the second shot going to do the same for us? So Rachel, yeah, so welcome to a club. For all of the people who've had COVID, who've gotten vaccinated, they've experienced this too. So it's not just you. So it turns out that the first shot is more reactive for people who've had COVID before. And it's because your immune system already sort of recognizes it. So the first shot for the U is kind of like the second shot for people who haven't had COVID. We still want you to get the second shot, but the reaction from the second shot is not as bad. So you'll likely do much better with the second one. And if you happen to get the fevers and chills again after your second shot for a little while, go ahead and take some ibuprofen and Tylenol. There's nothing wrong in doing that at all. Pat asks, what do you think is safe visitation in nursing homes? It's time to stop the isolation. I agree. It is time to stop the isolation in the nursing homes. So what does a nursing home need to have to be able to relax its visitation? And the nursing home associations and the geriatrics people actually have guidelines for nursing homes on how to do that. And most of it has to do with having a significant number of the patients in the nursing home vaccinated, and including the staff. And it varies a little bit from nursing home to nursing home what that number is. But once the vaccination percentage goes up to a level that it looks like people are protected, a lot of nursing homes have relaxed visitation restrictions to some extent. So it's going to depend a little bit on the individual nursing home and its individual vaccination rates. It will continue to get better for them as we get more data in our older people and as more people get vaccinated and as the community rates start to come down even more. Kevin asks, what should we do to stay safe with such a low rate of vaccination in the state? Can vaccinated people really be safe without masks in public places? I think largely vaccinated people can be safe as long as you're otherwise healthy and you don't have other conditions that increase your risk, or you're not immunocompromised. There are some breakthrough infections that occur in vaccinated people. Your risk goes up some, but your odds of getting a breakthrough infection that would result in hospitalization is less than 0.0008%. So if you get it in a breakthrough, you won't be sick. So here's what I do. I'm obviously vaccinated, and when I go into places that have a lot of people in them, say retail stores, grocery stores, pharmacies, whatever, I still wear my mask. One is because I don't know about the people around me. Two, I like that little layer of Swiss cheese that's in there. And third, I do it out of respect for the people who work there, because they have no idea who I am and whether I'm vaccinated or not. And it makes them feel better. I'm still wearing my mask indoors and in public places. Outdoors, I don't wear my mask, and I don't think it's needed. But I'm pretty confident. I'm not really worried about getting COVID if I'm vaccinated in public places and I have a mask on. And if I think that most of the people around me are vaccinated, I'd probably take the mask off. But most of the time, I don't know that, since we don't have little name badges that tell people where we're at with that. Teresa's asks, what is your opinion on a vaccinated person associated with an unvaccinated person at dinner or sharing space during a girls' weekend? So, you know, what the CDC guidance would say is that if it's unvaccinated people and vaccinated people getting together in the same space, that that the unvaccinated people should be masked, which is a little bit uncomfortable. What are you going to do? You know, you've had a dinner party. Okay, you're unvaccinated. Why don't you sit over there and you know, wear your mask? We'll talk to you loudly every now and then so you can participate in the conversation. And oh, here's a cone-shaped hat to put on your head while you're sitting over there. But you know, that's kind of exclusionary. So maybe you could all mask, and then at least that way everyone can participate and you can all sit together and you don't have to distance, and it would be okay. So you could do that. Or you could do it outdoors, and then you don't have to worry. No one really will need to mask. Or you could do it in a more distanced way if you're indoors. So there's different ways of doing it so that you can all get together. Lastly, Donna asks, is there any help on the horizon for long haulers? I have no taste or smell since December and distorted taste and smell since February. Everything tastes rotten. Yeah, I feel for you. That's miserable. What we're seeing is that the loss of taste and smell and the change in your taste and smell slowly goes away. Vaccination seems to make it go away faster. At least that's what's out there and people are saying. So be patient. I think it's going to be all of the other things that go with it, like the brain fog and fatigue and general lack of energy, is going to be a response to it like we use for other fatigue syndromes or other post-viral fatigue illnesses. And basically it's wellness. I'm not trying to be trite, but it's getting the right amount of sleep, slowly increasing your exercise, eating right, and generally having a sense of wellness. If you're overweight, lose weight. That helps a lot. But it's I think with time it'll get better for everyone. The loss of taste and smell seems to slowly improve for people. So hang in there. Hopefully in a few months it'll be back to normal. So with that, any questions from the group here? Nope. So I'll go ahead and hang it up. We will see you next week on Thursday morning, and we'll see what's happened between now and then.